Hi everyone. Today marks the 9-month anniversary of my bilateral total knee replacements. You can see I'm doing well. I'm in heels. I'm going to take them off the rest of the video. I just want to show you that yes, you can wear heels again. I was wearing heels just a couple of months after surgery, and my knees are great. I do fine in heels. I'm back to all of my regular activities. Except running. I don't do a lot of jumping. I have done kickboxing classes. I do a lot of cycling, really good on the knees. Hiking, walking, weight training. So back to all the activities that I did before the surgery and better than ever, because I'm actually able to do things without falling, without pain at night. I can sleep through the night again. So here's my 9-month update, and I'll give you a timeline of some of the things that happened and what you can expect possibly with your surgery. I will state that every surgeon, every implant, every patient is different. So I elected to do both of my knees at the same time. You may choose to only do one. Once you hear this video, you get to make the decision up for yourself. There's a lot of information out there. There are support groups on Facebook. Just a lot of people who are willing to share their experiences with either bilateral total knee replacements or just a bilateral total knee replacement, doing one at a time versus both at the same time. So I encourage you to look into the information. Don't let it scare you. What should scare you is people's negative attitude, negative feedback that's constant, because that negative feedback is not going to help you in the long run. So I think it's really your attitude and your intent and how you stay focused on that intent of healing that's going to be the most helpful for you to recover. So that's my experience, and I'm going to share my experience over the past 9 months with you. I did do, I think, 9 videos back in February to talk about what I was going through when I had my bilateral total knee replacements, because there wasn't a lot of information. And then I had to stop because I had a lot of stuff going on and I was trying to heal myself. I got off Facebook and the recovery groups because they were so negative. And my experience, while there were complications, I wanted to stay positive and focused on what was happening that was positive. So a couple of small setbacks that I had were I got an infection in my left knee underneath. The sutures from the stitches got infected underneath, the ones that are supposed to dissolve. So I had to go back on antibiotics, I think at about week 4. And then the next one was I could not straighten my left leg all the way, and I couldn't bend my right one beyond 90-95 degrees. So at 9 weeks, I had to have, or I elected to have, a manipulation under anesthesia. Not all surgeons do this, I hear, but my surgeon asked me if I wanted to do it and try it, and I said yes. So under anesthesia, they knock you out completely. They straightened my left leg and they bent my right leg because the scar tissue had caused it to adhere, and I couldn't do it on my own or through physical therapy, and we were rough on them. So coming out of surgery, that same day I was much better. I continued to wear my compression stockings, but that same day that I returned home, I was out shoveling bark dust and putting it around my yard, and I did a whole dump truck by myself in 4 days. So that goes to tell you how active I was, how set I was on continuing my activities, and also the success of the manipulation under anesthesia. I would have done it regardless of the MUA, but it did help me progress and get stronger after that. And now I can straighten both legs completely to 0, and I can bend both legs. I don't know if you can see, but I can almost touch my heel on both sides. They are 140 degrees. That's what they measured. One was 138 and one was 140 in my last day of physical therapy at 10 weeks. And I elected to continue my physical therapy on my own because I trained pretty hard at the gym without the help of a physical therapist. So I have continued. I have my strength back. You can see my calves. Everything is, they're big. Everything has come back and I feel great. So that was my experience. I took 1 week off from work. I was working at home in week 2, and at week 2 I traveled to Lake Tahoe, which is a couple hours away in air, and then another 90 minutes from the airport or so. And I had the help of my colleagues and the great hotel people, and just a lot of support along the way. But I was able to work and travel after 2 weeks. That's not for everyone. And then I was driving after about 3.5 weeks, and back to walking regularly as soon as I got off the walker. I was off the walker in about 3 weeks, and then onto a cane. I was back at the gym after 2.5 weeks. I was, let's see, the MUA was at 9 weeks. I was back to pretty much all of my activities at 12 weeks, except I did not wakeboard over the summer. And again, I said I don't run, and I haven't been jumping a lot, just a little bit in kickboxing classes that I've taken. So I say let your body speak to you. If it hurts, then modify the activity. They do say don't do the high impact activities because it'll wear out your joints faster. And then also I still have swelling and I still have stiffness. So I just listen to my body. If I overdo it, then I modify things the next day or the next time. But I feel really good. So I'm very pleased that I did it, and I would do it again because I didn't have to go through 2 surgeries, 2 sets of anesthesia, 2 full sets of physical therapy, and then asking people for help, all of those kinds of things. And being a single mom, I just didn't want to put my family and my friends through that again. They were amazing, but it still was a very difficult, very humbling process for me. I had a lot of breakdowns. I didn't know it was going to be so painful for so long and be so difficult to lift my legs and to function without the help of the walker or people for the first 2 or 3 weeks. So my best advice is to make sure you do have help 24 hours a day for the first 2 weeks with bilaterals. I've heard people with 1 can get around fine. I don't know, I only had my experience of 2. So you'll have to kind of gauge that and talk to your doctor, talk to your friends and family, and decide that with your support team. I'm happy to answer any questions if you want to email me or leave notes below, or ask me to do another video on whatever. It might be travel or I don't know, things come up. I get questions every week. That's why I'm making this video. I get a lot of questions from people on should I do one at a time or should I do both? And all I can talk about is my experience with it. I haven't talked to anybody that's done both and regretted it. I'm very happy with mine. My surgeon was amazing. My physical therapists were amazing. So I just encourage you to look at the options and talk about it with your family, because it does take a lot of support in the first 2 or 3 weeks to get through it. And a very strong and positive mindset going into it. My intent was that I would be fully healed and the best patient my physical therapist had ever seen, the best recovery. And in the end, my physical therapist told me I was their best case scenario that they'd ever seen. So, but that was my intent going into it, right? So set your intent and focus on it. Don't complain. Embrace the pain and know that you have to have the pain to get better, and then you will see it when you believe it. So that's my experience. I hope it helps. I wish you all the best, and blessings to you in your surgery and recovery. Cheers.